All right, konnichiwa, Dr. Brazes here. Thank you so much for tuning in and welcome. Today, we're going to do reaction videos on sports injuries to the face. Oh. Freaking hockey, man. Oh, tooth gone. Oh.
That came up fast.
Okay, so that one was a slap shot to the face, and it knocked the guy's tooth out. That's a tough one. So if you ever have a situation where you're playing sports, your child is playing sports, and a permanent tooth is knocked out, the most important thing is keeping that tooth vital. In other words, keeping the nerve of the tooth, the blood vessels of the tooth alive. If the nerve and the blood vessels of that tooth die, the tooth is going to die, essentially. So timing is critical. You want to be able to reinsert that tooth into the mouth, like into the right spot, as soon as possible. And so if there's not a professional there that knows how to do that, you want to put that tooth in. Hank's solution is the best thing. They also say milk works pretty well. The other thing, if you don't have any of those things, which at a sporting event, who the heck carries milk with them, right? So if you don't have milk with you, then the best thing is the patient's saliva, right? So it would be blood, because there's obviously going to be blood coming out, but have them spit in a cup, and it'll be a mixture of blood and saliva in there, and soak that tooth in the blood and saliva. The other thing you can do is have them just put the tooth in their mouth, right? Just hold it in their mouth like it's a
gumdrop,
or a jawbreaker or something, but just make sure they don't swallow it, right? So the key is to get to the dentist as fast as you can. They're going to reinsert that tooth into the mouth where it's supposed to go, and then usually they'll use some sort of light wire to then you'll glue the wire to the teeth next to it and to that tooth itself to splint that tooth and hold it into place while it can, like, heal into the bone. And the hope is that it reattaches to the bone there, and that it stays. Now, something like that, you always want to watch that tooth to see if it turns dark in color, and it may not happen for 5 years. So for example, I had these 3 teeth not knocked out, but knocked back, and then I had them reset right away, so I was able to save them. But years and years and years later, like I think 6 years later, actually I was in dental school, so 10 years later, they started to turn dark, which means they did eventually die. So I had to get root canals on those teeth. But again, you'd rather have root canals than have the tooth be missing. How could that have been prevented? I mean, even if he was wearing a mouth guard, a puck to the face that hard, it may have saved that tooth and prevented it from getting knocked out, but that's a pretty hard shot. Like I don't know if it would have saved it or not, but theoretically what would happen is if you're wearing a mouth guard, you take that blow to the face, and then the mouth guard is going to distribute that force evenly to the remainder of the teeth. And so maybe the teeth still get loose, but probably not fall out. So that would be something that could have prevented it. Or I know in youth hockey a lot of times they'll wear face shields, right, where it covers their whole face. Never NHL players will wear that because it's like a rite of passage to get a tooth knocked out. I think if there's any NHL players that I'm offending here, please don't be offended. But that's kind of how that goes. So tooth knocked back or knocked back, just have it reset right away, splint it. Tooth knocked out, you want to preserve it for as long as you can. Get to the dentist as quickly as possible. Have them reinsert it and splint it. Orthodontists can put braces on. I've done that for patients before as well, where it's like it's a sibling of someone, they don't have braces on. And so tooth gets knocked out, I get them numb, I reinsert it, I put braces on all the teeth, and then put the wire in to hold that tooth. That's what I would use for a splint, because I can use braces. Whereas a dentist might just use like even like a fishing line works, but you just need to hold that tooth to the other teeth in place while it heals. So,
how long do you have before your nerve dies?
Every patient is different, but if it's a young child like that, the apex of that tooth is pretty open, so you have a little bit more time. If it's an adult, you don't have as much time, but yeah, I can't give you like a definitive number, but like I would say within an hour, you want to try to get that tooth put back in. The faster, the better, though.
Next one.
Okay. Oh, another hockey one.
I didn't know that was a thing after a break. And now a breakaway pass.
Took a stick to chipped his teeth off, and then still scored a goal later, huh? Yeah, chipped tooth, not quite as severe as getting the tooth knocked out, obviously. So there's different degrees or levels of a tooth fracture, right? First one, grade 1 means it's just in the enamel, meaning the outer surface of the tooth, it's not a big fracture. That's pretty easy for the dentist to fix, not an emergency. The second grade would be what's called a grade 2. That means the fracture has passed. There's different surfaces of the tooth, right? So the enamel is the outer shell of the tooth that's hard and protective. The inner surface of the tooth is called dentin. It's not quite as hard, not as protective. So if the fracture happens and it's into dentin, dentin is darker than enamel. So that's how you can tell. If you look and there's like two colors in the tooth, the darker color is the dentin. Again, still not an emergency, but that'll be more sensitive to cold. You're definitely going to want to get a filling on that as soon as you can. And then a grade 3 would be all the way to the root or the pulp of the tooth. If the root is exposed, the nerve of the tooth, so the pulp would be the nerve and the blood vessels of the tooth. If it's chipped all the way to the pulp and that's exposed, then you will need a root canal on that tooth and probably a crown that covers that tooth to make it safe. So make it protect that nerve protected. So grade 1 into enamel, don't have to worry about it too much. Just and that's what this one looked like. This one looks like a grade 2. So grade 1 into enamel, not a huge emergency. Probably won't even have sensitivity issues. Grade 2 into dentin, still need to get a filling there. That's probably what we have here with Celebrini is a grade 2 fracture. So he's going to have to get a filling there, and then grade 3 would be all the way to the pulp. Another scenario is if it fractures all the way down at the root. So anytime you have trauma like this, you want to have your dentist take what's called a periapical x-ray, which takes a picture of the root. They'll see if there's a fracture down on the root. And so usually if there's a root fracture, you still just leave the tooth there, but you just have to know that there's a root fracture. So you got to be a little bit more careful with that tooth. All right, let's see what's happening here. Can't tell. Lacrosse check.
Knocked out 3 of his teeth, and it got me thinking.
And
did I capture one of his teeth coming out?
Oh, he took a shot to the head.
Yeah, I did. Look at this clip of
Tooth
the
fell
tooth
out.
coming out in slow-mo. I couldn't believe it. And I think
All
this
right,
just
he
shows
says he's
the
okay.
grit and toughness
So I think that's going to be similar to our
that
first
they
one.
had. Specifically Gannon Matthews. What
Yeah,
a
the
shot,
tooth falls
what a
out.
play.
How hard do you have to be hit for your tooth to fall out?
Not that hard, honestly. I mean, like, oh yeah, he busted up his lip too. So it comes down to leverage and angles. That's kind of what it takes you have to hit it at the right spot at the right angle to knock a tooth out. It doesn't take a ton of force. It just has to be the right angle and the right spot. So this was a big hit though. Like I wouldn't be surprised if his nose or even his jawline was fractured. So let me give you a scenario of a kid I went to high school with. I played baseball with him. He was playing softball. He took a softball to the face, and his 4 front teeth were just kind of like hanging there. So his jaw was actually fractured, right? And the scenario I told you before where I had these 3 knocked back, that's actually a fractured jaw, but it's just at the tooth level, right? And so again, that's why we had to plate him together surgically. So I just kind of like, put braces on him just to hold everything stable, just like we talked about in that other case, while the bone up there could heal. Now there's a scenario where that bone doesn't heal, it necroses, which means it kind of like still gets an infection and rots out. And in that case, I mean, he's gonna have to do some sort of major prosthesis to get it fixed. But case like this, it looks like just 1 tooth came out, but yeah, similar to the first case, like it's a situation where you want to preserve that tooth for as long as you can, and then have the dentist re-implant it or reinsert it as soon as possible, and then have them do like some sort of splint to hold it in place while it heals. Knocked out mouthpiece. Boom. Oh, the mouthpiece flies. He's fine now. He's okay. Oh, but then he got knocked out anyways.
Combinations today by
Oh,
using the jab a lot.
poor guy. Luckily, the guy hit him in the side of the head, not in the mouth. So.
Threw that jab and then he acted like he was going to throw another jab, but I call it.
All right, so the good news is, on the first shot that knocked out the mouthpiece, that probably saved his teeth, right? So that's why, like, when you're playing contact sports, again, mouth guards are just so critical because that saved his teeth, essentially. Now, the blow to the head, the second blow to the head that knocked him out, he's probably concussed, right? So that's a situation where you'd follow concussion protocol, right? You don't want to, go to sleep for a while, you want to make sure that everything's okay. But again, from a trauma standpoint, if you take a shot to the head and you don't know where you are, definitely seek out a physician to go to the ER, make sure everything's okay. From a tooth, jaw, dental standpoint, this guy's probably going to be okay because the mouthpiece saved him. All right. Oh, another boxing one. Oh, busted lip. Oh my gosh. What a strong elbow. Oh, crap. All right, that's going to be stitches. Plastic surgeon needs to do that one. It's too big, right? It's too big. So once the way that I would suggest on something like that, if it's contained within the lip itself, ER doc could probably do it, right? Dentist could do it for sure. Pretty much anyone could do it if it's within the color of the lip. Once it extends, it's the lip, and then it extends all the way up here, probably better off with a plastic surgeon. That's who I would want to do it in that case, because the amount of scarring is going to be pretty significant. And so the plastic surgeon is going to be able to approximate that scarring a lot better and minimize it. Whereas if you have an ER doc do that, again, they're going to be able to put you back together, just the scar may be a little bit more severe. So that's a shot where it's going to be so significant that you want, if you can find a plastic surgeon to do that repair for you, that's certainly what I would recommend. If it's big enough to need stitches, like, that's not small, it's still gonna be big. But again, if it's on the lip and it's maintained within the color of the lip, you're probably okay having pretty much anyone suture that together. Lip heals pretty nicely without a lot of scarring. But once it extends way up here, like, that's one, and it's just minimal out of the lip, you're probably still okay with having an ER doctor do it or dentist do it. But I mean, that's like it's almost like an inch outside of the lip. Definitely want plastic surgery on that. Not surgery, but a plastic surgeon to repair.
Ready.
All right. Oh my gosh. Look how bad the picture feels. This one happened recent. I remember this one. So he is. I don't ever get close-up shots on these, so I can't give a definitive diagnosis of what happened. But it looks like they're holding his nose. So if you guys didn't know this about me, I played baseball, and I took 2 balls to the face. One when I was 12 in All-Stars. Ball came in from the outfield. I lost it in the lights. I was playing shortstop, and it hit me right square in the nose. Broke my nose. Only about 1 millimeter. So I went to the doctor, and they're like, you don't have to reset it because it's not, it's not off enough to where you would even notice it, right? So, but in this case, it's probably off pretty far. So he's going to have probably an ENT or ER doc reset that. So they're going to go in and reset his nose, align it up where it should. Why do you have to do that? It's not only a cosmetic thing. Like if your nose is crooked, yeah, that doesn't look good. But once the septum's deviated, it gets hard to breathe. Right, it gets hard to breathe out of your nose. So you want to reset it so you can maintain a good airway, good airflow through your nose. That's one thing to do it. Other time I took a ball to the face, ball hit me right here, and as it hit me, I'm hypothesizing here, but I bit down. And so I had a very big laceration inside my mouth, had to get 7 stitches. So again, luckily their teeth weren't affected, but yeah, I had to get stitches and stuff. So yeah, baseball players, you see now, they have those side things on their helmets where it protects their jaw and their face if a ball were to come there. But the problem here is he was squared around a bunt, so the ball came in and it hit his bat and came up him square in the face. So again, nose problems, that's a broken nose, so you're probably gonna have to have that reset, unless in my case it's not a severe break, and then you can kind of just go with it. But main reason is not just for cosmetics, but because that septum is now deviated, so you want to get it lined back up so air can actually travel through the nose again.
If you have a laceration inside your mouth, who takes care of that?
For me, that was ER doc. Probably would have been better off with an oral surgeon. Again, not to knock the ER doc, he did a great job, but oral surgeons, they are really who knows what's up in terms of facial trauma. So plastic surgeon, I said plastic surgeon, you could have an oral surgeon do that one as well. So the guy that split his lip way up here, plastic surgeon, oral surgeon, those are the 2 doctors I would trust with that one. Inside your mouth, pretty much, again, not a hard one because you're not worried about scarring, right? So that's why ER doc would probably be fine for something like that as well. I still do have a scar there, like if I run my tongue there, I can feel it. Like I can feel where those stitches were and where that was repaired.
Let's go.
Oh, another hockey one. Connor Bedard, this guy's awesome. Oh, he broke his jaw. At least that's what the headline says. Broken jaw. He knew right away. Okay, so broken jaw. This is where you need an oral surgeon, right? So what they're gonna do, that jaw is now separated, right? So it's probably just hanging there. And if he opens and closes, it's only moving on one side. It's probably moving in one direction because it's only this is the joint that moves your jaw, right? So if it's fractured anywhere from here to here, right? And you're opening, it's only gonna go one way. It's not gonna go vertical now. So what are they gonna do in that situation? Any oral surgeons out there, feel free to correct me, but they're probably gonna go in, access the jaw, plate it, screw it, and hold it together while it heals. Maybe have you wear some sort of elastics or rubber bands to hold the bite in the right spot while it heals. So this is an uncontrolled break. Let's talk about a controlled break. So sometimes I have patients that their bite is so far off, I can't fix it just with braces. We need to do a jaw surgery to correct it. So that's what's called a controlled break. So let's use the top jaw for an example. They're gonna separate the top jaw from the skull, that's controlled. They'll bring it forward and then they'll plate it together. They'll have the patient wear rubber bands that attach to the elastics or what's called mini implants to hold that jaw into place while it heals. So you'll wear those pretty much all the time for about a month while the jaw heals. And so probably similar here, they used to wire the jaw shut. That's how they held it in place, but you know, who wants to live life just sucking liquids through a straw because your jaw's wired shut? So now we use rubber bands / elastics instead. So hold that jaw into the proper position while it heals. I think the protocol now is orthognathic case where we do jaw surgery, liquid diet for 30 days, soft foods for another 30 days. So that's the hard part in the recovery of a fractured jaw is the diet. You're gonna lose some weight for sure. So, all right, so in a lot of these scenarios, you know, whether they got loose teeth knocked out, broken jaw, whatever, any trauma to the face, usually the teeth are going to be a little bit mobile, right? Or a lot mobile. They also get a little bit loose or mobile with braces. Don't worry, there's a reason for that, and we'll go over that in the next video. So click here. Thank you so much for tuning in. Again, remember, smiles change lives, so keep smiling.